For reference, a little more than 2 months ago, I was in a motorcycle accident, I was severely concussed, I nearly cut off my left arm, and apparently there was damage they didn't realize until the past few weeks. After all that time, some things are getting better, but I still have no use of the bicep and very, very limited use of the deltoid, and they think that's part of the injury that they didn't realize until later. Now, when I first woke up in the hospital, it didn't hurt. I think that was a combination of shock because I'd gone through a traumatic experience and a whole lot of drugs they had me on, including ketamine, which I didn't even know was a thing. But they pumped me full of ketamine, they put on a ketamine playlist, and then they dug around inside my arm for hours trying to figure out what was there, what they could fix, and what they could do. Then after the surgery and after coming home from the hospital, there was pain around the site of the injury, around the elbow where it was partially severed, but a lot of the pain was actually coming from swelling because the hand and arm swelled up so big they looked like a watermelon, and it put pressure on all the pain receptors. And the swelling is largely under control now, so it doesn't hurt nearly as bad. And there actually isn't a lot of pain around the site of the injury, except when I do PT. Because the bicep was fully severed and had to be sewed back together, I have to do a lot of range of motion work. I can't go full extension, and I can't go full contraction, because when I go near either of those extremes, it hurts a lot. Plus, I'm not supposed to go full extension because they want to make sure the bicep has time to heal before it gets fully stretched. But the really bad pain in this whole process is from a place I never expected. It's from my shoulder, and it's nerve pain. Because their new theory for why my bicep doesn't work, why I can't use the delt, why all these things are issues, is that I actually tore something in the brachial plexus. That when I got my arm caught in the drain culvert, not only did it nearly sever my arm, it actually put traction, or it jerked on my shoulder hard enough to do damage to that nerve bundle. And it didn't make sense to me to have this massive trauma on my arm, but be laying in bed just crying because my shoulder felt like somebody was sticking a hot knife through it and not knowing what was going on. And once they put me on nerve medication, that changed the world. Now, sometimes it flares up really bad or it changes in severity. It seems to be an issue, but for the most part, it's under control. So the pain is definitely manageable, and I'm actually now sleeping more nights than I'm not, which was the exact opposite because for a long time it felt like I was lucky if I slept one night a week. So I'm making progress, and I have a test today to try to find out what's going on in the brachial plexus of my shoulder, and maybe, just maybe, we can make some progress toward getting my arm back fully functional.